studying is please the Archbishop of the Catholic Diocese of Nyeri, Anthony Moheria, will lead us in prayers. Archbishop.
Ask God to be in our midst and to bless us by calling upon his name. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Almighty and ever-living God, you are the God creator of all, who has wished that we, your creatures and children, may accomplish full happiness at the end of our lives, and also peace, harmony, and happiness here on earth. We are gathered in our meeting here today to deliberate and learn from the challenges presented by the COVID-19 pandemic. It has threatened the lives of Kenyans and people all over the world. Pandemic that has broken the social and economic fiber of the society. A pandemic that has tested our faith in you and our God. A pandemic that has tested our humanity and the care for one another and our deep values. We know you protect and care for us at all times. As we begin our meeting, we thank you for a tremendous protection in our country, where we have been saved from the huge scale of calamity witnessed in other nations. We thank you for all that the various agents and individuals, the government, both national and county, have done to contain and defend the lives of the citizens. We pray for all the COVID victims who have lost their lives, for those who have lost their loved ones. Lord, please comfort them. We pray for those who are still suffering from COVID-19 in hospitals and in homes. Lord, touch them with your healing hand. We pray for the affected families through grief, stigma, or financial stress. Lord, come to their rescue and grant us ideas to help them. We pray for the health workers and all who have collaborated in this fight against COVID. Give them courage and resilience and reward them in your own ways. Guide us in today's discussions so that they may be constructive and useful for our nation and for future generations. Send your Holy Spirit to be with us and to fill us with the necessary wisdom so that ideas and resolutions may be a starting point for a better welfare for our Kenyan people, wherever and whenever we are faced by a crisis. And we ask all this through Christ our Lord. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
We may please be seated. Allow me, sir, to now invite the Cabinet Secretary for Health, Honorable Mutai Kagwe, to hand over the COVID-19 report to His Excellency the President. Waziri Karibu.
For a better wealth.
Cabinet Secretary now presenting the report, COVID-19 report, to His Excellency the President. Tuwapigie makofi kwa heshima.
Excellency, fellow leaders, the report that I have just handed you, Your Excellency, is the work of the National Emergency Response Committee on Coronavirus, and I would like to take this opportunity to thank all the members of the committee, those in your cabinet and those others who are not in the cabinet, and to just say it has been hard work, it continues to be hard work, and Your Excellency, we can just affirm that you continue to do the work that you have ordered us to do. Having said that, Your Excellency, this is an interactive session, and for that reason, I simply wish to invite you to come and make opening remarks, and then we can go into the discussion. Your Excellency, sir, if you could all stand up to welcome you, sir.
Asante sana, please be seated. Thank you very much. Good afternoon, everybody. The Chairman of the Council of Governors, leaders from across the entire spectrum of our society, our clergy, who are the custodians of our faith, members representing the private sector, our friends from the Fourth Estate, all our development partners, members of civil society present, and most importantly, the people of Kenya, all of whom have shown an unprecedented unity of purpose and a singular determination to prevail and bounce back better and stronger. Indeed, it is with great pleasure that I welcome you all to this National COVID-19 Conference, and today's conference is intended to review our national response in combating COVID-19 and chart our nation's future within this global fight against this pandemic. It is in this context that I invite all of you to join together in this national moment of stock-taking, reflection, learning, and planning. This conference has the task of providing the nation with a trustworthy account of what we set out to do when this pandemic hit us 6 months ago. What have we achieved so far, and what are the consequences of our work? This account is meant to give us a picture of what has worked and what has not, and the reasons why. The primary purpose here being to tease out lessons learned, as well as best practices, but fundamentally, we are meant to ask ourselves whether we organized our resources in the most optimal way, and whether we have mechanisms of plowing back lessons learned into future undertakings. Ladies and gentlemen, the new normal in Kenya and the world can only be defined as a known unknown. That is, we know the extent of COVID disruption and the kind of havoc it has wreaked and can wreak. But we don't know how the disease will morph in the future and how the new normal will unfold. This aspect remains unknown to all of us. And if the new normal then is known and unknown, then this must be a questioning conference. And the tone of this conference has therefore to be a questioning one. And I urge you to question everything that we have done in the last 6 months in order to tease out what we can plow back. If we make this a questioning conference, I want to propose a 5-point questioning framework to participants today. This framework should guide us in understanding our performance and indeed charting the way forward. 1, where were we efficient in our approaches to this pandemic? Can we say that our methods and our undertakings have delivered value for money? Are there lessons on how both human and financial resources could have been better applied? And how do we increase the value of our resources moving forward? 2, were we effective in what we set out to do? Can we ascertain the extent to which intended results were achieved in the last 6 months by the different agencies involved? And is there a cause-effect relationship between the results we achieved and the resources we put into containing this crisis? Thirdly, were we sufficiently responsive to the unknown twists of this pandemic? And by responsiveness, I mean the ability of our agents to participate, or our agencies to participate and respond to the peculiar challenges of this pandemic with timely and appropriate actions. Have we built this ability and speed in our systems as we de-escalate the COVID measures? And this is a question we must all ponder today. Ladies and gentlemen, the first 3 questions in my suggested framework are meant to assess the achievements of the last 6 months, but also allow me to table 2 further framework questions to guide our moving forward. As we plan to face the new normal, we must pose the question whether the methods and approaches we used in the last 6 months are still relevant today and in the future. And by relevance, I am inviting the conference to assess whether the mode of delivering our response to COVID-19 should continue. Should we replicate it for future planning? And what must we re-engineer after teasing out the lessons learned? My last framework question is about appropriateness of our COVID interventions. By appropriateness, I'm inviting the conference to reflect on whether our response to the pandemic was built on other existing platforms and whether there was resonance with what people wanted. If our response to COVID-19 resonated with the people, the interventions we built have a good chance of becoming sustainable. And by sustainability, I do not mean continuing the investments we made. I mean creating a cumulative chain of benefits arising from what we have done. If this conference, therefore, is guided by my suggested 5-point framework of questions, I am persuaded that we will deliver a trustworthy account of what we did for the last 6 months. But more importantly, the questions should also tease out lessons that will guide our future planning as well as our engagement. And I am confident that if we continue to work together in tandem and in the unity of purpose that has typified our joint efforts over the last 6 months, Kenya can and will emerge from this crisis better and will indeed bounce back stronger. And to co-create the new normal, the consciousness of the entire nation must be called to order. So therefore, ladies and gentlemen, it is indeed my great pleasure to declare this conference officially open, and I look forward to fruitful deliberations that will guide us as a people and as a nation going forward. I thank you all for your attention. May God bless you, and may God bless this nation of Kenya. Asanteni sana.
Thank you. you very much, Your Excellency, sir. Allow me now, sir, to invite Dr. Mercy Koril to moderate the health response panel. Daktari and your panelists. Karibuni, take the stage.
This disease is
the fact that COVID-19 pandemic has not resulted in massive deaths in Kenya has some Kenyans convinced that
Punchline Africa Television is one of the leading online media networks in Africa, commanding over 2.5 million views a month. Punchline Africa TV is home of Conversations for Change and for all your current affairs updates. Take part by joining us on our social media platforms on Facebook at Punchline Africa TV, on Twitter at Punchline Africa, and on YouTube at Punchline Africa TV. Punchline Africa Television, for Africa, with Africa, by Africans.
Peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
From the word go, the World Health Organization indeed gave us questionable information. Information that could not lead Africa, and especially give Africa the way forward to prepare themselves. That has indeed dented the credibility of the World Health Organization. The credibility is further dented by the advice that came up about the flights that we saw. We are told there's no transmission that could take place from the flights, and later on they changed that there was a link between the flights, the air travel, and the COVID-19. Today, as Africa looks back 4 months ago, what have we achieved? And what have we done? How many countries in the world are joining the growing list to demand transparency, openness, to demand reasons, to demand answers as to why they were not told about certain steps to be taken, like washing hands, keeping a distance at an advanced stage? When did the World Health Organization know that this disease needs to wash hands? You need to stop it by washing hands. You need to stop it by standing a distance of 1.5 meters away from your partner or your friend or your relative or anybody that you meet. When
Chinese officials ignored their reporting obligations to the World Health Organization and pressured the World Health Organization to mislead the world when the virus was first discovered by Chinese authorities. Countless lives have been taken and profound economic hardship has been inflicted all around the globe.
These are some of the things, and this week or last week, Russia joined a growing number of countries to demand answers. There are several countries that are demanding answers. Kenya is on the committee, is now appointed on the committee of the World Health Organization Council. India is the chair-led person, and India itself, as the chair, has already triggered a debate as to why this was let out and destroy the world. Whatever they will come out with will not go away from my original opinion that I formed on the question of COVID-19 coming from Wuhan in China in December and only declared a pandemic in March. Those who have ears can hear.
None of us would have anticipated the spread of what started in Wuhan city. And we would never have anticipated that the virus would spread across the world and indeed was going to impact all of us. When 2 months later, Egypt announced the first COVID-19 case in Africa, it became pretty obvious that the tentacles of the disease has stretched itself across the borders and was heading for us. I think it is fair to say that, as we know, Kenya is a hub for international NGOs and media, not to mention that there is a lot of traffic across our African nation, and therefore we knew that the clock was ticking. We will recall that there were tense moments that transitioned us from the period in March, and on the 12th of March 2020, the day on which the first case was confirmed, I remember explicitly because we all knew that the status in our nation had begun to change. In fact, to just think about what we were, the capacity we had, excluding the nations which had catalogued experience on airborne pandemics, Kenya resembled the rest of the world with regard to our collective preparedness for this scourge. Despite our varying development status, we each found ourselves in a scramble for financial and material resources, particularly PPEs that were urgently required. Core to this, of course, was the imperative to protect our healthcare workers who, to this day, continue to be the front line as far as the defense against this disease is concerned. In this period also, during our first case, and the rest of the world, we suffered huge losses, not just in terms of jobs, our vulnerabilities, and worst of all, of course, is people that have been confirmed for coronavirus, with nearly 1 million now dead. And that is a large number when you talk about 1 million people. But notwithstanding all these things, I think it is also fair to say that COVID-19 is also, as Your Excellency has alluded, leaving us as stronger. It has made us stronger in very numerous ways. And yes, I'm indeed saying that there are many silver linings that our coronavirus experience has brought to us, and we should appreciate. Foremost, of course, being that the apocalyptic projections that we had for the pandemic, we have not experienced thus far. So at least for that reason, we thank God. I think secondly, we must also acknowledge and appreciate that in spite of the myriads of problems, and we are going to mention some of them here, I think we can say that our attempt has not been the devastation that we originally expected. And yes, we will cite science, others will cite God, and arguably, indisputably, God has been in the forefront, and we are a God-fearing nation. So we have been saved what looks in Europe, what was happening in Europe. At the time that we were starting to look at our situation, you will remember that we had very, very little capacity. And Your Excellency, the first thing that brought us to where we were, the first thing towards achieving some semblance of capacity building is when what you have directed to us and the leadership that you have provided on the measures to undertake, and that leadership has been absolutely critical. Every system is as good as the leadership it gets, and Your Excellency, you provided that leadership. So the first thing, leadership, is one of the things that we were provided for. The second thing, I think, is that the formation of the National Task Force in January and the multi-agency approach that through the National Emergency Response Committee is also an important part of why we managed to get ourselves together, even as we were scrambling for all sorts of other things. And I think, Your Excellency, the fact that the counties responded as quickly as we expected and hoped, and cooperated with us in an unprecedented manner, also was part of the containment that we managed to keep. But, Your Excellency, as we look forward, as we strategize on our way forward, allow me also to give some appreciation for the collaboration present. Were it not for our development partners, were it not for the partners who are here with us, we would not have been able to contain COVID-19. And we created a slow development. I think in terms of containment, let's also agree that it was a question of a slow development in a manner that does not overwhelm the healthcare facilities that we had. And talking about healthcare facilities, if you remember, on the 12th of March, you ordered us to very quickly put together an infectious ICU unit. When on 12th of March, we had 8 beds in Kenya, 8 infectious disease beds. And today, we can almost argue that almost every county has got some semblance of a capacity that is almost higher than what we had in the entire country. And therefore, that is something also that we should count as an achievement. Along the way, of course, we have had many, many challenges. Challenges that are real, challenges that are imagined, but at the end of the day, they have been challenges that have been overcome largely. You will also remember that at the time that we had our first case, we had 0 testing capacity. No lab in Kenya had the capacity to test COVID-19. We were sending the samples, the first samples were sent to South Africa. And today, we have 38 labs spread around 12 countries. And it's an achievement that I must attribute to a lot of cooperation, particularly the lab people, the infectious disease doctors who are here with us, and we are proud of that particular achievement. And therefore, as we look back and wonder how was it, it is so easy to forget where we came from and what we started. And it is so easy not to appreciate how much work has gone amongst the doctors, particularly the health workers and the doctors and the labs. It is easy not to appreciate that, but I want to state here that we are very, very appreciative of them, and the challenges that we have and what we have learned is going to be useful for us and very useful for that matter going forward. I want to stop there so that I can yield time to others.
Okay, thank you. So, thank you for that round of applause. So, in summary, Bwana Waziri, how would you rate your success on a scale of 1 to 10? How would you rate it?
Well, first and foremost, I don't want to own that success. You know, I think that let's agree on what we mean by success. Success means that we have built substantial capacity. We are talking about nearly 400 beds that we now have across the country, and I'm talking about ICU beds. From 0 isolation beds, we are talking over 7,000 isolation beds across the country. We are talking about health workers who have been out there, and community health workers who have been out there visiting people in their homes and so on. So I don't want to rate myself as an individual, because it is not by no means an individual effort. But if you ask me to rate us as a country and what we have done, then I think I would throw it back to the audience to do that rating.
Okay, let's hear from the counties then. Maybe Governor Kuti would give a rating of the county's response, because we know, as Waziri has said, there have been challenges, especially in terms of capacity, human resource capacity, and actual facility and equipment capacity to handle COVID-19 response. So how have the counties fared on 6 months later? Would you say we are better off than where we started?
I've been assured by the doctors that we have got sufficient distance for us to be able to use the mics without a mask.
And we'll sanitize immediately after this.
Yeah, thank you very much. Your Excellency, good afternoon, everybody. I think when you ask that question of how the counties fared, I think the counties are the total picture of the whole country. And as Waziri has said, everybody was totally unprepared. And it is the leadership, and I would like to emphasize that the issue of leadership, where quickly His Excellency sprang into action and formed these layers of committees. We had the summit, and the counties were plugged in to the summit through our chair. So there was even a co-chairing of the summit between the President and the chair of Council of Governors. At the national emergency level, I was there. And there were other several agricultural committees which are chaired by Munya and Tarakanidi, Finance, Ukur and Wangamati. So the whole layer and the whole approach to fighting this disease was a well-orchestrated action right from the top that involved the counties to the counties themselves, where the county emergency response committees were formed, the sub-county, and there also it is national government, the county governor and the county commissioner, and then the wards, we had the ward administrators and the chiefs, all the way to the village where we had the community health volunteer and Nyumba Kumi working together. That's national government and county government. I think that whole structure, while decisions were made from up, reached all the way to the ground, and the discussions happening at the village reached all the way to the summit through this orchestra that has really been formed, that actually made our attack to this disease very effective. And the public were immediately able to see that leadership and move along immediately. You will see every time at 4 o'clock, the whole nation is glued to the TV, and every day when the governor is having his discussion on COVID, the county is glued to whatever, whether it's radio, and so there was serious awareness creation, there was a coordinated approach, and therefore what needed to be done at the counties could be done very quickly, and that's why we were able quickly to create the isolation wards, quickly to create ICU beds, quickly train health workers. The health workers, this is the first time we're having such a highly infectious disease in Kenya. We never had Ebola, even like Congo. So immediately they were trained all the way to the community health volunteers, and the whole nation was following and fully aware. It's like a football is a football match. We didn't have football, but I think COVID became the focal issue in the whole country at both national and county level, and therefore that resulted in a lot of motivation among the people, among the workers, among the health workers, the necessary steps taken to protect the health workers, especially the idea of manufacturing, because for a while we were left high and dry, because Italy was scrambling for PPEs, America was scrambling for ventilators, everybody was scrambling and every country was on its own. And I think for a while that brought out a spirit, a very special spirit that I would like to urge His Excellency the President and the whole country not to let go of that spirit that we developed out of COVID. That every Kenyan stood up, those who are able to assist their neighbors. I know people who could actually share their own food, and there was a reasoned spirit of patriotism and nationalism that really awakened us. The other thing is the spirit of having found that we had no ventilators, we had no ICU beds. Then the leadership provided by His Excellency to say now we start manufacturing, and citizens started and our juakalis started springing into action. They made those beds. Some of those isolation beds are made by our local artisans. Face masks. All counties have now capability to make face masks. So today the health sector and actually all other sectors are much better off because of the awakening of this spirit. I want to just leave one message. As I was having lunch today, I had a toothpick, and I brought this toothpick. And I looked at it and I say, bamboo toothpick made in China. And then I came and sat on that. Everybody should look at their table. There are 5 or 6 items. There is sweets made in South Africa, in front of you. There is Dettol made in Bahrain, in front of you. There is sanitizer made in China, in front of you. There is only water and macadamia that is made in Kenya that is in front of you. I think the spirit of Kenya has now awakened to the fact that we need to make our own ventilators, we need to make our own toothpicks, we need to make our own sanitizers. There is no reason why we should have all this made in China, made in Bahrain, made in South Africa here, because we don't have the same made in Kenya in that China, we don't have made in Kenya in that South Africa, we don't have made in Kenya in these other countries. We need to therefore carry the spirit that has awakened. COVID brought its own death, its own wreck to the economy, but it awakened the spirit of Kenyans to be patriotic and to produce face masks, ventilators, PPEs that are of high quality. Therefore, something must come out of here that we should actually, and I'm grateful that this book, the Preferential Procurement Master Roll, and I thank Betty, to have produced 334 items that we can produce. Why should we still use other countries' items when we can produce these 300 and more? And this should be now the baseline, and we only have to go higher. Thank you very much.
Thank you, Governor Kuti. I think we have veered off from the health response, but it's good at least to bring the Kenyan spirit and the spirit of patriotism. So I'll quickly go to Dr. Ivan Jenga, the chairperson of the Kenya Medical Practitioners and Dentists Council, just to ask about quarantine, because your council was really responsible in looking at our quarantine facilities. And at the beginning of the pandemic, we got a good number of cases from quarantine. Why was this? Were we unprepared, or were there any lapses that really caused people to contract the virus from quarantine centers?
Thank you, Mercy. Your Excellency, I think this is a very good time to reflect on our challenges, our mistakes, and the strengths that we've learned moving forward. I must say, I remember as soon as the airspace was closed, the Medical and Dentist Council, that's a regulator of health, was told to get other teams and other regulators together and set up quarantine centers for all the incoming flights. And the people that, and I think, yes, there were mistakes, Mercy, and you say we went wrong, but I can tell you, I think that's one of the most important steps taken by our leadership that actually stopped us, and we may live to say this is maybe why we don't have the numbers, the enormous numbers that we were expecting. Yes, we said we got very few transmission or infection from abroad. Eventually, with most of the transmission that is ongoing in Kenya is local. We were able to nip the outside or the travelers, any transmission from travelers from those quarantine centers. And those quarantine centers, I can tell you, it was like an overnight. We worked almost 24 hours. Some were health-based, most of them were non-health-based, putting the teams together that took care of the medical aspects, the psychosocial aspects, security. It took different people to come together. And I like what my colleague, Governor Kuti, has said, that collaboration where everybody stopped saying this is my sphere of function, and we all came together with our security forces, our medical personnel, our partners, private partners. We had AMREF and Red Cross giving us psychologists, because we knew from the start that we needed psychosocial support. So I know, yes, we made mistakes, but that main one action has really reduced the numbers that we are seeing today. So I think we should, you asked my two bosses how they would rate themselves. I'm a regulator. I think I can actually rate you as the county, because we've been going round under the leadership of my bosses at the ministry, the CS and the PS. We have technical teams going round, Your Excellency, looking at, and they were the ones who went to go and see whether the directive of having the 300 COVID beds was adhered to, or it was how it came through. I know it wasn't an easy exercise, Governor, but I can rate you. We went and we did in 1 month. I know 80% is like an A in anybody who has ever sat exams. And we found most of the facilities and most of our counties scored 80%. We had a score sheet and scorecard. You scored 80%. So honestly, let's stop beating ourselves and appreciate ourselves. The other group that I would want to appreciate even during quarantine is the public. This pandemic has affected all people, the families. When you took people to quarantine, the families were also affected. Businesses were affected. So all spheres of our life was affected. So we all came together as Kenyans and responded positively. Let's not also lose that moving forward. As we strengthen our health structures, even to move, we are still within COVID. As we move post-COVID, other health services must continue, facilities must improve as we also embrace UHC. And UHC will only be a success if we make sure primary health care at level 2 and level 3, Governor, that we make sure that that is successful. Then moving forward, we all be prepared for whatever comes in future. Thank you.
Thank you, Dr. So to Dr. Ombajo, the all-important question that many Kenyans are asking is that at the beginning of the pandemic, and Waziri was there telling us, we've seen Italy, we've seen other places, people have been hit hard. But when we look at what we see in the country, 93% of our cases are asymptomatic. We don't seem to have been overwhelmed or to have really suffered the bite of COVID as much as other countries. And why is this the case?
Thank you, Mercy, Your Excellency, and good afternoon, everyone. So as you very rightly say, when this pandemic initially started, I think all of us were very afraid because of what we'd seen world over. We'd seen devastating scenes of hospitals overwhelmed, of people dying, of the large number of infections that are out there. And indeed, the initial modeling that we're doing seemed to indicate that we'd follow an almost similar trajectory in terms of having a very high number of cases and a very high number of mortalities. And this hasn't been the case, not just in Kenya, but in many African countries as well. And there are many sort of theories to try and explain what this. As CS said, maybe God loves us more than everybody else. But that aside, we could look at, is it the interventions that were put in place, or is there something about our population that puts us at lower risk for very adverse outcomes? So if we think about the interventions, at the very first case that we had, there were some interventions put in place. For example, the limiting number of entries into the country. When we look at the countries that had the biggest outbreaks, they had very many people coming in with COVID and setting up multiple outbreaks within those countries, which means controlling became very difficult. So by limiting entry into the country, that was a very big deal. And as Dr. Njenga says, that quarantine and limiting spread at the very onset was very important. The other thing to look at again is other interventions that we must not downplay. We embrace the issues around wearing of masks early. And we have to thank our government because they did listen to scientists and they did listen to doctors, which was very encouraging for us at the front line as well. Then we think about our population. What is it that's different with, let's say, the European population? And one is that we have a fairly young population, with our mean age being just about 20. And you look at countries where the mean age is 45 and above. And from what we've learned from our own population is that the younger people are less likely to get severe disease, are less likely to die. So for that reason, we've had a much lower outbreak. I guess the question then is, what do we do going forward, knowing that, one, we may have something that protects us, but still we cannot drop the ball because we cannot afford to have a big spike.
Okay. Thank you. I think maybe you explain a bit of that, and some of the interventions may be questionable. I can hear the bell, so I'll quickly go to Bonaziri and read out some names here. Those Dr. Doreen Lugaliki, Peter Kiare, Marian Awor, Abdi Yusuf, Clifford Manyara, Moses Ringera, Dr. Ndambuki Mboloi. These are just 7 of 16 healthcare workers who passed on after they contracted COVID-19. And there have been conversations about compensations for healthcare workers for particularly even medical cover, their life cover. Bonaziri, do you feel any sense of responsibility to these 16 families and the more than 1,000 other healthcare workers who've been infected by the COVID-19 infection? Because you kept saying they are the frontline soldiers, they are our frontline soldiers. What responsibility does government have for these 16 and the 1,000 others who've been infected?
Thank you very much. First and foremost, I think is for us to appreciate and condole the families of the healthcare workers who lost their lives, but in addition to that is also indeed condole all Kenyans who lost their lives. And every life is as precious as the other one. And the reason why we were so careful with healthcare workers is essentially because these are the people who are protecting us. And if we had epidemic amongst them, then we were going to be left bare. What did we do? We first started by creating a special ward at Kenyatta National Hospital, specifically assigned for healthcare workers only, so that even as a disease evolved, we were not going to have healthcare workers scrambling for bed capacity, scrambling for treatment amongst other people in other hospitals. So we created a special unit for that purpose. You will also recall that we appreciated the fact that they were going way above the call of duty. And if you remember, the president ordered that we create a special fund, a special accommodation, a special allowance for them during the height of the epidemic, which essentially just goes to show the sort of care. Thirdly, if you look at the way we moved in terms of trying to get PPEs for them and spread them across the counties, we changed the law to allow for counties to be able to purchase PPEs not just from KEMSA but from anywhere they could get them, because let's not also forget that at the height of this whole pandemic, during March and April, getting a PPE was a big problem. just like my colleague has said. So the fact that we changed the law, we deregulated purchase from KEMSA. But finally, is to say that even today, not just then, not just the consideration that has been going on, even today we are still looking at considering what we can do for our health workers, for the healthcare workers, what we can do for the medical fraternity as a whole. So we continue, and we haven't stopped. It's ongoing.
Okay. Thank you for that. But the families or these healthcare workers have been waiting since the announcement, since everything was passed. Is it the wheels of government, or what's holding all this back?
I think that a lot of what we have said has already happened. A lot of what we intend to do, for example, the issues of insurance and so on, are issues that are ongoing in discussions with the institutions that are responsible for that. We agreed that, for example, the NHIF was going to be able to cover the healthcare workers. We agreed that the county governments could also get cover from NHIF, for that reason. So it's ongoing. Every day we try and improve a little bit more. And if you talk about the lessons that we learned, that's one of the lessons to learn. That's one of the areas where we thought we had not really crafted properly in the past. We had not really crafted properly and in a response within the health community that is responsive or that is in keeping with, at the same size as the disease burden that we were experiencing. And yes, that's a challenge. And the worst thing we can do, in all the challenges that we have had, including the issues transparency, and we discovered that transparency is a currency, for lack of trust and speculation. Therefore, all these things are lessons that we have learned. And we can't bury our heads to the ground like the proverbial ostrich and assume everything is okay. We will continue to face them as we should.
Thank you, Bonazir. And now my last question to the doctors. Cholera is still here, Ebola is in the neighborhood, climate change is here. Will the country, from what you've seen in very few words, will the country be able to face the next public health emergency that comes its way? Can start with Governor Kuti, then Dr. Njenga, Dr. Eva, then Dr. Ombajo, then we close it there.
I think the lessons we learned is such that we are more prepared, much more prepared, both at the national level and at the county level, and also the fact that we now have a highly trained staff. The training we gave the staff for pandemics, especially highly infectious diseases, has put us in a better place. The investment we have made in the health in terms of infrastructure at the county level has actually improved our capacity very much. So we are much better off, definitely.
Dr. Njenga?
I believe that we will do better and we will continue to do better. And we are not saying that the pandemic is over. So please, the message out there is that we should not let our guard down. The corona is still with us. What we are doing is continue strengthening our infectious and isolation hospitals, Governor, and make sure that across with the national and the county governments, that collaboration and that friendship that has developed, we must continue, and involving the community. Community engagement is going to be the key, so that everyone knows, every member of of our population knows that the responsibility on how we respond and how we contain any pandemic or any endemic is a responsibility of each individual. But I think we've shown the world that we can do it.
Mm-hmm. Dr. Lois?
Thank you very much, Mercy. I think, yes, we are better prepared to handle a future epidemic. But having said that, before COVID came, I ran a unit where we had many patients with cholera every day. Since COVID came, we haven't had a single case of cholera. So clearly we are washing our hands more. We are washing our hands more. We are eating at home more, perhaps. But there are certain things that we've learned as a population that we must not lose beyond COVID. The simple hygiene measures have to continue.
Thank you. Thank you very much. We'll wrap up this panel here. Thank you, CS Kagwe, Governor Kuti, Dr. Njenga, and Dr. Ombajo. I'll welcome the next panel led by my colleague Trevor Mbija. This is the panel on resource mobilization and utilization for COVID-19 fund. But as we exit, there will be a video just running, so please do watch the video. Then the next panel is coming in.
Provide all necessary assistance to groups, communities, social economic sectors that have been hardest hit by the pandemic.
We set up a small committee made up of staff from Interior, Ministry of Health, and State Department of Social Services to go to the field, to go to the slums and isolate the most vulnerable. And we had a very good criteria. People who are orphaned, children who are actually heads of households, people who have terminal illnesses, people basically who have no other way of survival.
Nilikuwa nafanya vibarua za mjengo, kufua vibarua tu ili waweze kukula. Vile sasa COVID-19 ilikuja, ikabidi vibarua zimekatika. Ikabidi sasa nimebaki tu kwa nyumba tu, sasa sina otherwise. Lakini venye serikali ilianza kututumia cash transfer, at least ikanisaidia kuwa akaweza kupata cha kukula.
Watu wa cash transfer kikuja kama saa hizi wakinunua mkate, wanunua maziwa, tunafaidika.
Safaricom being the platform that does the M-Pesa bit, they have done something very fantastic in this. What they have done is that they have helped us transfer this money at no cost.
Previously, when you are sending maize, beans and all that, you have to pay about 20-30% to logistics. Now, if we send 300 million shillings to Kenyans, it arrives as 300 million shillings to 300,000 people every week.
Kazi yangu ilikuwa ni kushona viatu. Wakati corona ikiingia, kazi yangu ilididimia, capital ikaenda chini, ikawa sasa sina mapato tena. Hii kazi mtaani hakika imeninua, mambo yale yangu yalikuwa yamekwama ya rent house na chakula ni itaendelea kama normal.
So kazi mtaani is one of the many interventions that national government has put together with respect to the COVID-19 response. The criteria was, first of all, you must demonstrate dire need. Secondly, you must not be benefiting from another social protection program. So like if you're a recipient of the cash transfers, you are not considered for this particular program. And number 3, you don't come from the same household.
Nilikuwa nafanya tu kazi ya saluni, nikaenda pale hivi my estate kufua nguo, wakafunga ati kuna corona. Sasa senye hii kazi nasema imenisaidia jisingekuwa na kazi.
My microphone is on. Thank you. There we are. Thank you so much. Good afternoon, everyone. Kindly just wave. I can see we are all tired, but please, gentlemen, we are happy to be here this afternoon. It's the middle of a pandemic. Thank you so much. I'd like to recognize all your presence. My name is Trevor Mbija. I'll lead this next panel discussion on the COVID-19 resource mobilization and utilization as well. This is where the rubber meets the road. And the president asked a fundamental question. Did we use our money and resources prudently? Okay. And efficiently. Thank you so much. All right. So there are more than 200 people who are joining us on Zoom. There are senators, governors, PSs, civil society. We want to recognize your presence. Mr. President, it's good to see you. Thank you so much. You know, when people meet the president for the first time, they tend to cry. So I came with my handkerchief just in case, but I'm glad. I'm happy to see you. Thank you so much. All right, so I'd like to introduce my panelists real fast, beginning from my immediate right, Dr. Julius Muya, the Principal Secretary, National Treasury and Planning. We have Jane Karuku, who's the Chairperson, Kenya COVID-19 Fund. We also have Honorable Justice Retired Paul Kihara Kariuki, who is the Attorney General. Thank you so much for making time for us. And Sid Chatterjee, Resident Coordinator, United Nations. Thank you so much for coming in. And Governor Wycliffe Oparanya, who's the Chairperson, Council of Governors. Thank you so much for making time this afternoon. In the interest of time, we'll get right into it. PS, you are the accounting officer. The President posed a fundamental question. Did we use our resources prudently and efficiently? Let's start from the point of how much did we actually have when we started the fight against coronavirus?
Well, thank you very much. I'll actually go a step back and answer the question, did we also raise our finances in an efficient manner? But first, let me say that when the COVID visited us, the situation that we had was one of declining revenues, and then again we had a lot of pressure because the expenditure pressures were caused by floods which were there in December, the locusts that came end of December, then we had a dry period earlier on. And so as Treasury, we looked at where can we get money quickly and money that is not expensive. I think that is very important. And so we looked at our multilateral partners. And in this case, it was World Bank, whom we were having a program of development policy operations. We looked at FDB, that is Africa Development Bank. We looked at IMF, and they were able to give us fairly low-priced loans in that case. And then we were also able to get funding from Danida as a grant. The total pledge that we were able to mobilize was 134 billion Kenya shillings. Right. Including in that was 130 billion that we received in exchequer.
All right. I think that deserves a round of applause. 134 billion shillings. But PS, did we use those resources prudently?
Now, what then did we do with that money? First, we identified what were the immediate needs as developed by the ministries and the institutions that were at the forefront. And so what we were able to disburse was 82 billion Kenya shillings. Now that 82 billion comprised of two main elements. One main element was 53 billion, which was on account of directly COVID-19 related expenditure. The other component within the 82 billion was 29 billion that we used for budget support because our revenues had declined considerably. And so in terms of using prudently, for us in Treasury, we made sure that we only made money available when there was a convincing case.
All right.
Thank you.
So we still have change of about 52 billion. We'll talk about that in just a bit. The Attorney General, there's been a lot in the public media in the last few weeks about procurement. The President himself gave directive, 21 days, so that we get the facts from the fiction, from the investigative agencies. How far are we with that?
Thank you, Trevor. We've made good progress. The investigations commenced on the 18th of June, following the allegations of irregularities in the procurement. And principally the culprit, so to say, was KEMSA. The action taken with regard to those allegations of some 7.8 billion shillings. Firstly, the EACC approached it in a two-phase mode. That is to say, they looked at public officers who were alleged to have participated in those alleged losses. And the second phase will be to the suppliers some 78 plus companies locally and elsewhere. As regards the first phase, some 52 persons of interest have been called in to write statements, and they have. And the documentation with regard to the payments has been secured and has been analyzed. And as we speak, a report has been tendered to the Director of Public Prosecutions with regard to those cases involving public officers. And the DPP is currently reviewing that material and will at some stage in the very near future decide on whether or not prosecutions will proceed.
Yeah.
Even as that is going on, the EACC has embarked and is progressing well on the second phase, which entails, as I've just said, the companies that were the suppliers. That is the current state of play.
Yeah. What are some of the lessons you think we should learn from the relationship between the Ministry of Health and KEMSA, for example, so that there's not any backpedaling and also it was me, it wasn't me, she said, who said, nobody said. How can that be made more efficient?
Well, this will be informed more when we have completed the investigations, because there'll be administrative issues, there'll be legal issues that come into play. We will examine the legal framework, and we did this with the other cases that have preceded this, like anyway, it will come to mind. But as CAB Secretary Mutahi Kagwe observed earlier, our institutions are only as good as the persons who lead them. And as His Excellency has said, and persistently in the war against corruption, he has led from the front by personal example. That is very, very, very critical. And as leaders, whether it is at ministerial level, whether it is units like KEPSA and so on, the leadership must be above board.
Okay.
And we assume in a time when we are caught up in a situation like we have, that we're good. Of course we're good.
Yeah.
But we forget one fundamental. There are people out there working night and day to take advantage of these pandemics, these very circumstances, to make money. If you don't believe me, go read the 1948 novel by Albert Camus, who is a French author, who detailed the effects of a bubonic plague and the effects that has on men.
Okay.
There was an old pharmacist there who was hoarding medicines and selling it at sky-high profit.
Okay.
We have the same in this country.
All right.
We must say as a nation, no, we are not going there.
All right. Thank you so much. Governor Oparanya, you've been on the receiving end. The Control of Budget report mentioned that the counties could only account for 3 billion shillings out of 13 billion shillings. At the time, it needs to be made clear it was at the time. But how do you rate the performance of counties when it comes to the resources? How much was allocated to you and how well did you use it?
Thank you very much. First of all, you must understand that there were county response committees that were formed, and it was the responsibility of these county committees to come up with measures to contain the spread of the disease. And in the process, these very committees came up with work plans, financial requirements that was required, and this was the coordinating committee. At the initial stage, because as counties, we were not sure where we were going to get funds, we agreed each county to prioritize their own requirement. Through that process, counties were able to put together 6.1 billion through virements, and the amount varied from one county to the other. I think the lowest county provided about 10 million, and the highest county provided 400 million. This is the figures that we got at the Secretariat. But at the national level, because when the disease started spreading, of course, through His Excellency, he organized extraordinary summit where we met, and we requested as county government that we needed support. In the process, we were given 5 billion from the national government through the order of His Excellency the President. Now, it reached a time when we thought that we could motivate frontline health workers. And when other counties were thinking of how much to pay, we engaged SRC, and SRC came up with standardized or uniform payments to these to the frontline workers, and through the Ministry of Health, we were given 2.36 billion. That is the only money I can say that we received directly from the national government. But however, we did receive 350 million shared equally to all counties from TANITA, 350 that went direct to level 2 and level 3 hospitals or health centers. And then finally, we received a donation of 30 million to specified counties, about 13 counties from the EU. But this money unfortunately never went direct to the counties. Yeah. The EU used independent agents to carry out activities in the few selected counties. And that's the money that we received. For the 5 billion we received, a special audit is being carried out by the Treasury, by our internal audit, National Internal Audit Office. For the last 2 weeks, they have been in the counties, yeah, and we are yet to receive a report.
Yeah, but from where you stand, would you confidently face Kenyans and tell them there was value for money? Their money was used prudently at the counties?
I can tell you that this money was prudently used. But as I speak now, not all of this money has been spent, because of the bureaucracy of moving from one financial year to the other financial year, because there were supplementary budgets to be undertaken because it was towards the end of the year, yeah, and also there was a shortage of some goods on the market. Okay. So some of those goods had to be imported from overseas. You could not get ventilators, you could not get beds, they had to be imported. Okay. Some of them are just arriving now, but there was proper commitment because the county response committee had to come up with work plans and commitments. So this money was actually committed, although it has not been exhausted.
Okay. So there's still some change as well.
There is still some change.
Change here.
Yes.
So let's bring in Jane Karuku on this. Yours is a different story. Yours is what the president called unprecedented unity of purpose. How much did the ordinary Kenyans and the partners, everybody else, how much did they raise towards the COVID-19 fund, and how was it used?
Thank you, Trevor. I'll try and answer all your questions at once so you don't come back to me. I've learned what you're asking. So I think when we were created by Your Excellency, I think he was very gracious. He gave me a great team. And I can tell you, you can imagine how our board meetings went between James Mwangi, Michael Joseph and others, and Joshua. But it was a lot of fun. And we were also lucky to get C.S. Matiang'i and a very good secretary in Kennedy Kihara. And Governor Oparanya was also part of that. So what we did immediately is that we knew our objective was to raise funds from the private sector and others. We formed an entity to protect ourselves. So we are a company limited by a guarantee with a board of directors. That's what we know how to do best. We formed committees, and we were laser focused in terms of what we were going to do. So we only chose two things: supporting the health sector and supporting our communities in livelihoods. We brought on PwC, Deloitte, and KPMG, and Ernst & Young to make sure that we can fully account, and Trevor can answer you 2 years from now whether our money was well used. So we did it up front. We also brought experts to support us with health. So the health committee, which was led by Dr. James Mwangi, we adopted Professor Masharia, the great ENT specialist, and a group of medical doctors, Union, KPMDU, Nursing Council, and clinical officers, etc., because we didn't know what was going on. This was tough. We then made a few principles as a board. We said, whatever happens, we are going to pay a premium for buying local. So we said any money raised in Kenya is going to be spent in Kenya so we can sustain and build Kenya jobs. We then said that anybody who's going to help us with this work is going to do it for free. Trevor, we didn't even take a cup of tea.
Oh wow, that deserves a round of applause. But how much did you raise?
So we raised, we had in kind and in cash. In cash we raised just over 2.6 billion shillings. We coordinated food worth about 450 million. And then we received food, which the KDF were gracious to store for us at Kawa Barracks, worth another 430 million. We then decided to prioritize the spend, how we spend the money very quickly.
Yeah.
Health, PPE was the biggest challenge. In our committees, there was Ministry of Health representation in Dr. Kariuki. So we decided to work with the local manufacturers to do fit-for-purpose PPEs. And I can tell you, the doctors, even today in the morning, I asked them, they are confirming they are good. And Bedi and other people have started exporting into the region. So that's good. We worked together with Kenya Association of Manufacturers. And Phyllis, who's the CEO, worked very hard together with the health guys, sometimes even up to 1 a.m. at night, visiting factories to see whether we can produce. And Your Excellency, we were very shocked at the capacity we have in Kenya. We were even embarrassed. We visited Kitui with the governor. We visited across the country, Nakuru, a lot of places. And I can guarantee we can buy Kenya and build Kenya. And I think I like what Governor Kuti said. Let's get back. So in terms of the other things, so we bought PPEs, 1.5 billion we've allocated. We chose 65 COVID-related hospitals across the country and a few others like Madari and the military hospital just across. And we are also supporting Kiambu with Tigoni Hospital because it's by the road, it takes a lot. So together with Kiambu County, we are refurbishing Tigoni Hospital, Buy Kenya, Build Kenya principle. We then bought, so for the PPEs, we've promised the country that in the 65 hospitals, for 18 months, we are going to provide PPE. If we don't need, we can divert that money. But that's a promise we made. We then decided to give masks to our communities in Nairobi. We bought 2.6 million masks at the price of 100 million shillings, and we distributed, supported very well by Ngao and county commanders and other people, partners that we were working with. The other thing we've done is we supported the doctors with psychosocial support, worth about 95 million. I know you want to stop me, but I'm answering all your questions, Trevor. And then the last thing is what was really, really pleasing to all of us was the money we gave to the needy communities, about 100,000 people in Kenya, in Nairobi and the environs. We gave 1,000 shillings per week for a month, worth about 400 million shillings. Safaricom gave us a moratorium from Fuliza.
Yeah, I was about to ask you about Fuliza right now.
To tell our people to remove the money. They had a moratorium of 48 hours. Okay. Otherwise, it was going to be swallowed or measured by Fuliza. So thank you, Peter. So that was good. So what have I not answered you? So have we used our money well? We think so.
Yeah.
Because we think we have shifted, transformed the local industry. And I think when we gift back to Kenya, it's that we can do anything.
Okay.
That work with all those manufacturers was done within 2 weeks. Right. And there was a question of Your Excellency, then I shut up. He said, were we slow? Imagine if this capacity was in the country. We could have had PPEs on the day. Yeah. Because all we needed to do was order, but it was not there, and people had to develop. Thank you very much.
I'll actually wind up with the lessons that we've learned in just a bit, but let me bring in Sid on this. Sid, you represent the international community. What was the biggest role of the UN in fighting COVID-19 in Kenya, and are you happy with how the money was spent?
Perhaps it's important that I start at the very beginning, and the very beginning is in 2017, if you recall, President Kenyatta actually declared a national drought emergency in February. So what we were confronting, and people need to understand this, is a massive blow because of the drought itself, which had been simmering over time, and then comes the floods. Then we have the COVID, and then we have a locust invasion, and it was major. So essentially, Kenya was confronted by a triple crisis, ladies and gentlemen. It was not just COVID. And if you were to ask me on a report card on Kenya's performance, it's an A+, and I say that without equivocation. Secondly, let's look at what the United Nations family did. And I really want to commend the leadership of CS Yatani and CS Eugene Mwamba. By March of 2020, we sat down together at the United Nations family, repurposed $45 million or 4.5 billion Kenya shillings from our existing UN Development Assistance Framework to respond to this public health crisis. An additional appeal was put out on the 9th of April again together with CS Yatani and Eugene Wamalwa, and approximately $58 million was raised, or about 5.8 billion Kenya shillings. In the meantime, in consultation between President Kenyatta and the UN Secretary General, an additional $10 million was brought in, or 1 billion shillings, for the construction of a hospital which should be ready in the next 2 weeks with Nairobi Hospital, not only to respond to COVID, but something to leave behind as a post-COVID care facility for a 100-bed hospital. On all counts, let me just state this categorically, that we don't have any issues with all the investments we've made so far.
And that is a good point, because what Jiku has always been concerned was the money stolen.
I also want to, but then, the UN is a member states organization. It's not, it's not isolating, it's not on its own. And frankly, we would not have been able to do this had this not been for the absolute and unconditional support of the European Union, the United States, China, the United Kingdoms, Russia, France, Japan, the Nordics, India, Ireland, Germany, Netherlands. I mean, absolutely spectacular. And I really want to single out China for a moment, because the speed with which they were able to send PPEs and supplies, not just to Kenya, but across the 54 countries in Africa, was meritorious on all counts. So it needs to be said as it is. Yeah. With the European Union, for example, we are working very closely with CS Joe Macheru's office in order to digitize procurement, digitize land legislation. So I think it will be technology and innovation that will help us to overcome some of the perceived challenges. Yeah. But on all counts, as the resident coordinator to Kenya, as the UN's resident coordinator to Kenya, I'm very proud to serve in a country which has not just dealt with a triple crisis, but done so with great aplomb.
All right, thank you so much. And I'll give you each 30 seconds to respond to this question, because we only have about 10 minutes. I know time flies. I'll start with Dr. Muya on this. What are the lessons that we've learned going forward? And do you think we responded to the pandemic in the right way, sufficiently, like the President asked? Were we sufficient in our response to the pandemic?
Yeah, thank you. The lessons learned. First, it is the fact that we can deal with a challenge which is not normal. And that ties with what Sid has just said, because we had multiple challenges which were rolling and coming one after another one. And so, from also a resource mobilization point of view, it proved to us that we can raise resources using our networks and raise resources that are as cheap as possible. And also the fact that we can mobilize resources very quickly. But if I can also tie this answer to a question that you have asked, I want also to say we were able, against a lot of demands of resources, to very easily think about how to ration the money that we had, how to allocate, and how to prioritize. And that was using the frameworks of our public finance management mechanism, where we have got a very clear framework there. You've got to follow a budgeting process. And so that was a very, very important learning lesson. But then also on the expenditure side, we also learned that we can live with a lot less than we normally live with. Because we were able to curtail on a lot of expenditure. And we went through the financial year well. And as you said, there's still some change which is remaining on the COVID money, about 40 billion.
Okay, I'm not sure whether that's a good thing coming from the Treasury. If we can live with less than what we have, it means we should all brace ourselves for tougher times. Madam Karuku, I'd like to come to you on our change also, and what do you intend to do with the rest of the money, and what are the lessons that you've learned so far?
Yeah, so let me start with the lessons. I think the lessons is how we quickly came together, private sector, individual citizens, and government. And we try to approach this pandemic from a resource perspective. We had people giving us 100 shillings via the M-Pesa, and we had Dr. James Mwangi giving us a very significant contribution of 300 million shillings. We also had some development partners chip in a bit. The more important was a spirit of giving. So we got very many calls in our secretariat about how can I, as a church group, as a family, as youth, go and donate somewhere else. We had overwhelming requests. I want to contribute my time to your board, to your activities. What can I do? So there's a real good thing that Kenyans have from a spirit, and I think we should never forget that. The change, I don't think things are over. We don't know. I guess we don't know, unless today we are being told there is no more COVID. So the change is to help on any other urgent issue that we may need. We still have some people who want to give us money, I think. So I think we continue to fight on.
Okay. Attorney General, 30 seconds on the lessons we've learned and the sustainability ways going forward.
Thank you. As I said earlier, we're going to be looking at policies and procedures at KEMSA and the relationship between them and the ministry. And the example I was citing earlier, which escaped my mind, was the National Youth Service, where there were similar problems. And arising from that, there was a review report which was prepared, very extensive document, and handed over to the ministry concerned. And they are benefiting from that immensely. But there is one very important aspect that I must emphasize. And that is this. People will be prosecuted arising from what has happened at KEMSA. We as a people must learn. His Excellency earlier spoke about that unprecedented unity of purpose. Add to that effort. Add to that the most significant of them, purpose. It's got to be in our minds as Kenyans. It's got to be in our hearts as Kenyans. Who does this? It is we leaders, we who are charged. Whether in the private sector, like my sister to my left, or whether in the public domain. And what happens when these people come to court? We start talking about our tribe, our people being finished. I hope to God we can desist from that and allow the law to take its course to its logical conclusion.
Okay.
You talk about buy Kenya, build Kenya.
Yes.
Why don't we act Kenyan for Kenyans?
Okay.
Act as AG for Kenyans, as a Kenyan.
Okay.
And if we do that across the divide with my good friend, the governor here as chair, the three arms of government are here represented with patriotism, then we have a chance to give a truly purposeful legacy to our children who will come after us.
All right.
Thank you.
Thank you for that. Sid, 30 seconds.
Well,
yeah, go ahead.
The pandemic has reminded us the primacy of universal health coverage. I commend you, President Kenyatta, for having made that as an important part of your legacy. And as far as the world is concerned, it has become abundantly clear. You know, it was a Greek philosopher called Herophilus who said, without health, we have nothing. And the pandemic has just proved that to us. It's not about if there's going to be a next pandemic, it's about when it's going to happen. And I think our preparedness in getting universal health coverage right is the pathway forward.
Okay.
Thank you.
Governor, very briefly.
Now, when we
raise your microphone just a bit.
Yeah.
Thank you.
I think when we received the 5 billion, there was quite hesitant by some county governments to spend the money. Because as you know, EACC is hanging on everybody's head. So people were very hesitant. So in the future, I think what is required is proper guidelines. When such a money is released to counties, there must be proper guidelines. Secondly, institutions like the county assemblies, you know, they don't know how to deal with emergencies. They keep on playing their own politics. And it took time for some of the counties actually to pass their supplementaries. And the institution like control of budget should know how to respond when we have emergencies. Lastly, we must also have, I don't know if there is a national policy on dealing with the infectious diseases.
Okay.
If it is there, then the capacity, the counties have the capacity have not been built at the county level, so that they understand that when such a thing happens, how do we deal it?
All right.
Lastly, our working together as county government and national government, it has helped to contain this disease.
All right. Thank you so much. A round of applause for my panelists as they walk out. That is the end of it. Thank you so much. Just kindly leave your microphones there. They'll be sanitized. And now I'd like to call, you can walk out to the right. Thank you so much. I'd like to call upon my colleague Joy Doreen Bira from DW to moderate the next session. It's about building back better lives and livelihoods. But first, I'd like to draw your attention to the screen over there. We're going to run a short video for you just to see what we mean when we say we are growing back better and stronger. My name is Trevor Mbija. Thank you so much for listening.
You know, hunger is very, very terrible. Somebody is hungry, he can't do anything. So now is COVID-19. People have so much problem of food. They lost their job. That's why our now main function we are focusing as many people as we can feed. Present time we are feeding 2,400 people. In St. Paul Children's Home we are feeding 1,500.
Anybody who has been in the military will understand that when at war, in war, with war, you don't court-martial your soldiers or officers while the war is on. You finish the war first and then investigate the officers or soldiers who might have misbehaved or neglected duty. This is the doctrine of the institution of war. Today, Kenya is within the war and at war with an invisible enemy called COVID-19. And we must support the efforts of the frontline officials. Then we put them on trial later if there are mistakes. Remember, the country is at the weakest link now, and we cannot afford to deflect the efforts of those soldiers on the front line of fighting COVID-19. Thank you very much, viewers. That is me. From the word go, the World Health Organization indeed gave us questionable information. Information that could not lead Africa, and especially give Africa the way forward to prepare themselves. That has indeed dented the credibility of the World Health Organization. The credibility is further dented by the advice that came up about the flights that we saw. We are told there's no transmission that could take place from the flights. And later on, they changed that there was a link between the flights, the air travel, and the COVID-19. Today, as Africa looks back 4 months ago, what have we achieved? And what have we done? How many countries in the world are joining the growing list to demand transparency, openness, to demand reasons, to demand answers as to why they were not told about certain steps to be taken, like washing hands, keeping a distance at an advanced stage. When did the World Health Organization know that this disease needs to wash hands? You need to stop it by washing hands. You need to stop it by standing a distance of 1.5 meters away from your partner or your friend or your relative or anybody that you meet. When?
Chinese officials ignored their reporting obligations to the World Health Organization and pressured the World Health Organization to mislead the world when the virus was first discovered by Chinese authorities. Countless lives have been taken and profound economic hardship has been inflicted all around the globe.
These are some of the things, and this week or last week, Russia joined a growing number of countries to demand answers. There are several countries that are demanding answers. Kenya is on the committee, is now appointed on the committee of the World Health Organization Council. India is the chair person, and India itself as the chair has already triggered a debate as to why this was let out and it destroyed the world. Whatever they will come out with will not go away from my original opinion that I formed on the question of COVID-19 coming from Wuhan in China in December and only declared a pandemic in March. Those who have ears can hear. Those who don't, it's up to us. But the blame lies squarely at the doorstep of the agency of international stature that should have warned us about the COVID-19. That is my opinion.
Of course, trade the financial services have been affected. And therefore, also, there is the compelling need to continue servicing, the country, particularly in expending more on the health sector. And as a result of this, under the direction of our president, we are to come out and identify what are the critical elements that needs to be underscored. One, that there has to be a reason as to why we should contain sustaining liquidity in the economy. We are to cushion business, create, if not create, but at least sustain the jobs that are there. And additionally, there are also a significant number of this country, Kenyans, who had a lost job.